and today we're looking at hepatitis. Doctor is here. Hello, good morning.
Hi, good morning.
Dr. Arthur.
Yeah.
Yeah, I remember Dr. Arthur. Growing up, there was a Dr. Arthur. There's a hospital called Konya. I don't know what's it called.
Where was that located?
Tema.
Okay.
I remember Dr. Arthur. Good morning to you.
Good morning.
How are you doing
I'm
this
doing
morning?
Well, thank you.
I must say you look very good in your African shirt.
Thank you very much.
Okay. And so we're going to talk about hepatitis. First of all, tell us. We understand it has something to do with the liver, but give us a very deep education about that. What is hepatitis?
Okay. So when we talk about hepatitis, basically we are just looking at inflammation of the liver. Okay. Now the liver cells, they are called hepatocytes. Okay. And in medical studies, anytime you hear titis, we are looking at inflammation. So hepatitis simply means inflammation of the liver cells. Now, and when we say inflammation, you can liken that to, let's just so that we all understand what it is. You see, when you get a cut, there are things that happen. You see that the place swells up. Sometimes it's filled with fluid. It looks reddish. Sometimes when you feel it, like it's hot. So that process is what is referred to as inflammation. And this time around, it's not happening outside your body where you can see the cuts and all of those things. But it's happening in your liver where your eyes cannot see. So basically, that is what hepatitis is anything that is causing the liver to be inflamed, the cells of the liver to be inflamed.
What are the types of hepatitis that we have in Ghana?
So as for the types of hepatitis, there are 5 types of the hepatitis that we know. That's if you're referring to the A, B, C, D, and E. But in our setting here, the ones that we usually look at is hepatitis B and hepatitis C. They are the very common ones that we have here in our setting.
How prevalent is hepatitis B and C? Give us a little overview of the situation in Ghana.
So, you see, in Ghana, the hepatitis itself is seen as a public health concern. I always say something is a public health concern. It means that it's something that is affecting a community at large. It's no longer an issue of an individual. So, and if you look at statistics, for instance, hepatitis B before 2015 to 2019 was said to be about 12%. That means that if you take 100 people, 12 out of that are likely to have hepatitis B. And hepatitis C was said to be around 3%. And that is, if you take 100 people, 3 people are likely to have the hepatitis C virus. Recent statistics show that there is a decline in the figures, especially with hepatitis B. Because now the value is somewhere around 9% from 2015 to 2019 studies. So that's like the situation here in Ghana.
You mentioned the most common hepatitis is B and C.
Yeah.
How is it transmitted?
So hepatitis B and C usually are transmitted through body fluids. That's the main means of transmission. So we are looking at transmission through sex, that's either through the vaginal fluids, semen. You're looking at coming into contact with infected blood, and you're looking at people sharing sharp objects and all of those. So these are the very common ones.
And okay, so let's break it down. What are the risk factors? These are the common ones: sharing bleed and all of that. Let's look at it. People want us to speak Twi, but I know you are handicapped when it comes to that
I'll
part.
try my best.
Okay, nia doctor na kan yen chire mu kakra. Doctor kan Twi na ye dia ma no, but you bisa no say hepatitis and hunsem no etisen. And I say hepatitis no a public health concern. Na say abaye hunu say e ade a e ya hadwen yie pa e wo Ghana. Na say kan no say wo yi nipa 100 a. Me fa ni say eduenu ana 100 oha. Yes, nipa 100 oha. Emu beye edumienu ene wo bi. Na o say from 2015 2019 about form kakra ebeye 9%. Na o say Ghana ha no hepatitis a ewa hapa no eye B and C. Although you hepatitis A, B, C, D and E. Na ye busa ne say kwan be ne fa so a enya hepatitis ni bi. And o say enemu se woni obi da wo mo ho ban enti sebe oba ensu e wo oba mu ene be ma ho nsuo mix a ebetumi akofa sa hepatitis ya ba o ka se ye use sharp object say be a blade what no na nipa no hepatitis na etwa no moja na kaso unso etwa ubetumi enye bi or ka say body fluids na ehọ na meba no. It said that you can actually contract it by, when somebody has it, the person is sweating and the sweat gets on your body, you can get it.
Yeah, so the issue with sweat, currently, people have not vividly stated that sweat transmits that. But usually the point is that when you come into contact with open wounds, and for instance, you're playing a football match and you have, football match bruises. Maybe
Yeah.
I know what to
Contact
crowd, then there's a little cut somewhere, somebody has the cut. And you come into contact with somebody that has the virus, okay, the person is infected. And there's that contact between the open wound the person has and yourself. Or in the course of sweating, Ibiana, the cuts, the sweat just passes through the cuts, mixed with some of the wound fluids and all of those things. That's when you can look at sweat being, but sweat itself on its own cannot harbor the virus.
Since we're on that, let's look at one thing that also came up, kissing.
Yeah.
We're told that if you kiss and do the French thing and the tongue and it bleeds, you can actually also get hepatitis.
So another thing is, remember we said that when the person is infected with the hepatitis virus, it's in the blood. Now, if you take, the reason why people don't like to take kissing out of what can cause it is because you don't have too much control.
Okay.
In the sense that when you have bruises in your mouth, we brush every that times there are tiny sores in your mouth. Now, when you're kissing, it also has holes in your mouth, and let's say it's so deep that it has a content of DNA, and you can look at kissing being one of the things that transmit it. If you think it doesn't look too real, an example is when you go to the barbering shop and you get a haircut. You see, after the haircut, before your barber puts that spirit on it, you don't feel anything until it is put on it. Yeah, so that tells you that there are minor cuts or very, very small cuts that you can't even see. Yeah. But it doesn't mean they don't exist. That's why usually people associate kissing as well to getting the hepatitis.
Okay, so my next question, if there's a child close to you, let the child get out. Abofra benwa, mabofra ni influence. If you say me bebusa, question be who here say we say me busa. These are questions that came up. People like oral sex. Say sebi ode na no eko bema and I say odiko oba bi ase. Ye ka say eno nso so no. Se nipa no wo bia wo betumi enya bi.
Yeah, so the oral sex still comes to the point that senipa no your fan say bema no e na wo sa yare we ya. Actually mu say ne hu nsuo betimi ekita na ahabo sa virus
no.
Na yen kan say wo ba no e bia ansa na mo kodi sa agro no. Wo why bibia ma we nya cat bi wo wenum. Na sa de we enya ko wenum no, once is able to get into the bloodstream, there will be that transmission.
Wow.
So the caveat is there must be a way for it to get into the bloodstream.
Okay.
If it's able to get into the bloodstream or get into your body like through the sex, vagina, penis sex, then you are going to get that.
Okay, how about a man going with the mouth and the tongue into a woman's private part?
So it's the same. So when you take that, you are still looking at the fact that we need a way to transmit it into your bloodstream.
But you talk about bodily fluid and vaginal fluid.
Yes.
So if your mouth go there and the vaginal fluid comes up and you swallow it, is it possible? Let's examine it very well because people really have issues concerning that.
Right. So when you swallow some of these vaginal fluids into you, the whole point is the routes of entry is also another thing of concern.
Okay.
I hope you get it.
Okay.
So it's just like when you eat. Now, there's a possibility, I can't rule it out totally that it can't give you that. But the possibility that is going to cause it is what we are looking at. It's a slim chance.
It's a slim chance, but it's possible.
Yes, it's possible.
Okay, so let's look at the symptoms. When someone has hepatitis B or C, you said that the C is more prevalent here, or the B is more prevalent in Ghana. If someone has it, what are the symptoms?
So if you have hepatitis B, then the very common symptoms are that you might feel nauseous. Some people have nausea.
At what stage would that? So let's educate us first, even before we get there. If you get it, at what stage will you see the symptoms?
Great. So the symptoms of hepatitis B will start showing up when damage has been really caused. That's the point. Because on the onset, you might not even see anything going on. You know, it's just like your body is able to fight infections and all of those things. So there are some people that even come into contact and they're able to clear based on how strong your immune system is. But you can't risk that I have a strong immune system, so I'm going to go into contact with some of these things. Yeah. But when you come into contact with hepatitis B virus, for instance, and it starts to replicate, or the virus starts to multiply, and the damage begins, that is when you can have most of the symptoms.
Mami nkyerɛ mu kakra yɛbusa doctor sɛ yɛsi bi ɛkɔ so sɛ sɛbe ɔbaa ɛde n'ano ɛkɔ bɛrima ɛho a anaasɛ bɛrima de n'ano ɛkɔ ɔbaa se a obetumi anya ɔsi ɛnyɛ very common but esi sɛ mode of transmission ɔsi esi ɛnti ɛma yɛn ka sɛ yɛsi intense ntumi kɔyɛ ɛno no ɛho hia mi yie papaapa yɛbusa ne sɛ aberebɛn ɛna obi bɛhyɛ aseɛ ho nsonsansoɔ ɛwɔ ne honam mu mmerɛ a wanya hepatitis ɛna ɔka sɛ unfortunately mmerɛ a wobɛhu nsonsansoɔ na kyerɛ sɛ damage ɛsi dadaada na ahyɛ aseɛ no yɛ na nipa bebree ehunu and so when the damage has been caused, how does the person feel?
Nti say we through stage says na ebia na liver na started a issue. One of the things you can even get is jaundice. So you see some of them with the very yellow eyes and palm. Then aside that, some of them throw up, vomit, and all of those things. But what I want us to know and understand is when you have all of these things, it doesn't mean straightforward that you have hepatitis B, right? Or you have a liver problem. And one of the outstanding symptoms is dark urine. The urine that people with hepatitis B infection or a liver damage issue produce look very dark, or it doesn't look like the normal urine color. But even that, if you are not well hydrated, you can have very dark urine and all of. So you need to be careful when you are relating some of these things to the infection. The only way to tell that you have it is when you are tested. The symptoms will come, but when the symptoms come, the best thing you're supposed to do is go to the hospital, speak to a doctor, let the necessary assessments be made, and then they can tell you if you have the hepatitis B virus.
So can anybody just walk to a hospital and say, I want to be tested,
yes.
Although I'm not nauseous, although I don't have dark urine, and any of the symptoms you mentioned, I want to be tested. I want to see if I'm exposed to the virus.
Yes. You can actually walk into any lab and tell them that you want to do the hepatitis B screening test. The screening test is even very cheap. It's not that expensive. You can do a screening test, and then they will let you know if you are positive or negative. So that you don't really require seeing a doctor to test. You can walk to any lab to do the test.
Okay, and today go yeah fidie so say una you see fatigue na say wa bra pa obi o say me nanti kakra bia na ma bra na makoma bom peri. Next one no o say nausea and vomit na say obu betumi afono pa and so anhwe so obetumi afen so ya wa bufunu wo ho won say obufunu but enya wo say fe enti bia na wo obufunu won so de ne ba ya obufunu na wo fe abdominal pain na say wo yam betumi aya wo ya pa Ghana ha ye ka abdominal na akoso ya say ha but abdominal in science no abdomen no the whole stomach ni nyina and ye fe na ye funu ni nyina nti betumi anya ya that urine and pills too enti betumi ehunu say wo jonso no aye tuntum kakra na wagya nan so asa aye fita kakra eno so wo ho yellow of the skin, yellowing, I beg your pardon, of the skin and eyes. I friend jaundice. Nti jaundice a doctor kind no. Na che say when ni no ebe to me akokɔ sade. I say when ni aye yellow, wa we need sickle cell. Sickle cell for na ya na omo time e word that any kra no omo hydrate a it to me ekɔ. But then wo de no when ni aye sa akokɔ sade sa wo dwunso a say tum wo kwa jana bia, wajana bia no aye fita obehun say asa hunam nankasa nso so aye sa akokɔ sade wo hwɛ ho a obeka say na den why yellow dabra wo paul ho ni nyina eka ho. Doctor, what remedies are available for such people?
Yeah, so the good news is that Hep C has a cure. So Hep C, there are medications, antiviral drugs, and all of those things that can help you cure Hep C. But hepatitis B does not have a definite cure. So when you get hepatitis B infection and it gets to the chronic hepatitis B infection, there is no cure, but there are managements that can be done. So people are given drugs to suppress the viral load and all of those things. Then any other symptoms that they're experiencing, we look at how to help them not experience those tough times that they go through.
Well, I want to know, why is it so difficult to fight this hepatitis B thing? Is it attitude, or is it what? You are in a medical field. What is going on?
So the issue is actually early testing and then vaccination. That's the issue.
Okay.
People, so just like I mentioned, hepatitis B does not have a cure, but hepatitis B has a vaccine to prevent you from getting it.
Okay.
Hepatitis C, on the other side, doesn't have a vaccine, but has a cure.
Strange, isn't it?
Yeah. So so it's not like their discoveries are still being made. Research is still being made into finding solutions to some of these things. So the only thing that can help everyone is to get vaccinated.
So I can walk in and ask to be vaccinated, any government hospital at all?
Yes.
But they first have to do the test, right?
Yes.
To see if I don't, because once you have the virus, the vaccination does not even help anything. You need treatment. And so, as someone doctor, can you find a or say, hepatitis screening, or any do you have any fair idea how much it
currently hepatitis B screening maximum should be a 70 or 80.
Wow, she yarea eba osua etumi se okura ma wu eja wo ma any ebusua ho, but also say okuta 70 Ghana cedis aban yare sabia bia obetumi de era ho ye test, so now you're negative now your amount vaccination, the vaccine is free, right?
The vaccines have been subsidized.
They've been subsidized. But okay.
That's if you go to the government facilities, actually.
Okay, so in Ghana, most vaccination, nice time free. But them say hepatitis there and you're free. But then senior, it's been heavily subsidized.
Yes,
Or it's not heavily. Okay, so you've already talked about the complications, but then if we have it on the screen, if you can go through.
So when we talk about cirrhosis, that's the scarring of the liver. At that time, the liver, you can look at the image over there.
Yeah.
So you see the first image, the normal liver, that's how our liver is supposed to be.
Okay.
But when the damage has been caused to an extent, you have the liver cirrhosis looking that way. Looking like you've placed it on fire, kind of thing. And this is happening inside your body, so you can't even see it going on. And I mean, with time, people also can get liver failure. Now the liver no longer works. It can't help you in anything that you do. Then, at a point, some people develop liver cancer out of the infection. So those are some of the complications.
If we can kindly go back to what you showed before this one, I would ask doctor to kindly take us through. So let's look at the prevention again. You talked about a couple of them, but if you can kindly take us through.
Yeah, again. So the prevention, the chief of them all is to get vaccinated. Yeah. So once you are vaccinated, then your body produces the antibodies against it, so that if you should ever come into contact with the virus, your body is already protected, ready to fight. Your soldiers are in there, yeah. Then the other thing is to practice safe sex. And to add to practicing safe sex, you should ensure that at least you have one partner is okay. Multiple sex partner is also a risk factor to getting some of these things. Then, as I mentioned earlier, as much as possible, avoid sharing needles. You know, this goes beyond even hepatitis B, HIV, and all of those things. So just don't share sharp needles with anyone. Then avoid contaminated food and water. That's if you are looking at hepatitis A. Because hepatitis A, we say is transmitted through the fecal-oral route. So that has to do with contaminations of food and all of those things. But food and water will not give you hepatitis B. Yes. Then get tested regularly.
How regular?
So for hepatitis C, for instance, because hepatitis C doesn't have what we call the vaccine to protect, you can anytime 3 months or half a year, just go and test twice a year. So you can do hep C.
Me can't treat ya. Say by ya hepatitis in mouse, so no, you see, Bomodiana hospital. Na ye mau pania ebebo ho ban free hepatitis no afen so bomodia say ukunu ba ko oyire ba ko safe sex o boy ba ko o girl ba ko say won so who multiple sex partners condoms can help.
Yes.
Even with HIV, Mr. Musa famra na ye famu mako condoms can also help. And okay. All right. So avoid sharing needles. And your needles on blade and so can mo amopama de no obi use na ya munim sa wono enwo no de ama na nso use pani a mo de pama de e kan wo mo pa nyame mpangu but hwe na wo se hwe ye hu ye
na mo a mo zo mo ye drug use with syringes, then they share when they are taking their own drug injections and all of those things.
And also and now say avoid contaminated food and water. I know say hepatitis A no and no say to me fa
that's food and water.
And but na last one get tested regularly or say maninya we here dey so na e be nti hospital Ghana yem pet check up here.
Not at all. And that is our problem with hepatitis. I
had a horrible scare a couple of years ago and I started doing medical checkup. At least I go once a year. At least once a year. Because my doctor check me say BBA okay. And so doctor, one of the things me busa wa kan me gidi say ye bo obi mu a e beboa ye pa. I don't see yen to me any hepatitis sunkunim no. We say because as yen share that I'm funny seriously.
Yeah. People don't really go in for the vaccination. Well, at the end say ye de nyama bi bata nyama bi hu nti obi be ka say o na me de me bompa ye bibia nya me nkoje vaccine bia wo yesu dimu but wisdom is given from God.
Yeah.
Na sa nyama we a nyame aboa ye ama ye hu say oje vaccine na unya yare no ozo ojitu mu say nyame na ebo ama ye nya vaccine no nako na ye nkoma o sa vaccine no mbo ho ban rather than staying till the last, because the funny thing is once you get it, the vaccination won't do you any good. And you can go for your shots. Maximum 3 months. Some people do. It depends on the vaccine you are taking. So you are taking 3 shots. At the end of your 3 shots, for the next 10 to 15 years, you are protected. So what is the challenge is actually in the fact that people are not getting tested and people are not getting vaccinated.
Is it that the message is not getting out there?
So as much as possible, I would say that, so every year there is the World Hepatitis Day, which is actually 28.
Yeah, and it's on a Sunday.
Yeah.
That's why we decided to talk about it today.
So every year the message is supposed to be pushed out. But one challenge that we have is the message getting to the very low people in society. Like my great-grandmother who is somewhere in the village or my great-grandfather in the village somewhere. So they don't know about some of these things. And you see, explaining them to these people too must be on the level they can actually understand. Because Ebiana, me koka brofa kesia kesi ebi omo nti ase.
Ebi na woka brofu yo.
So we need to find a way to actually communicate these things to everybody, regardless of age, gender, and location.
People go to hospital all the time for various sicknesses and diseases. Don't you think that if we enact some sort of law, say we speak to the person, counseling, obi obeba hospital be because unko for choir sabia day in and day out. Senke wo mrebia because nipa ne ba woni ni nkomo say there's hepatitis testing or screening available.
Yeah.
It is over here, a so we are negative. And why me a kayama? You can say Nipano on Yare, on what Pentama Kojomo, Uncle Hospital, Uncle D-Line. So you know how our health delivery system is. Ubeko Kolebuano Pa, Ube free Hobea 4 p.m. Eti, say Nipano be binti oba. And I say, fans will be cry eating Yari for one. Maybe there is a way we can talk to them. Maybe this is what came to mind, and I want to put it to you. Say, you think it's feasible?
Yeah, it is. You see, for people that go for antenatal care, for instance, as for that one, you would get to know. And in fact, over there, it's mandatory for them to test.
Even HIV?
Yes. The other thing too is when people are getting married, premarital screening. So now, premarital screening is that hepatitis B is added to the premarital screening, like tests that you have to do for some churches and all of those things. So aside say nipa na ba hospital no, yeshia wo baby p, ebi mo call sorry, ebi mo call mocks, ebi mo call organizational meetings and all of those things. Say yeshia yenzu yehu se na ye betimi aka kire nkofo no, because nipa ni nya ho ba hospital na baby obenya ho akono yemfa asem no nta na.
So public education, like I was saying, low. Because Nipano Yenim said we have an attitude for not going for checkups. You're quite sorry. You're quite a mosque, bonfire. ye kwa ye any ade enti man say Ghana Health Service for set table e we ye bi ase no mo ka say wo apese wo ye screening for hepatitis no bra na be ye we negative e be ma injection nka ye di rura nka be boa wo
ebeboa pa. There are some organizations that actually do that, the Hep B foundations and all of those things. Let me just use this opportunity to thank some of my friends that have been hard on vaccination and screening people, like MLS Dela, MLS Yima, MLS Omari, MLS William. These guys are amazing. We go out sometimes to do Hep B screening for free. Go and screen people, and we give you the letters to send to a hospital if you are positive. But the challenge is, if you even give the letter to the person.
I was saying, Dr. ML here for that. Didn't come after hepatitis. Because Ghana hepatitis a hard dream pa a B and C. Now see B no. Ewa hapa sin C no na o se ni da so ho se wo dura ban ya resabia bia na ka se pe so ye screen e be ya ma we negative a ye be ma o some sort of vaccine e be boa ama o se the next 10-15 years na bo ho ban wo ho a na wasa akọ renew ebiom o san kan so say wo se ye de asem no ewura ba bia because wo ka se nipa no enko hospital na onko check up wonko but nipa no okọ mosque bompa ye okọ asori nti ani ensori no enkamom nti Ministry of Health Ghana Health Service we dey mo jejereje mo rewura sorry dem mo ni won enye World Hepatitis Day theme edaso no action now.
Yeah.
Action now. If you say the assembly ni enyan kakra sania eko no nti you say action now. Nti churches in Ghana action now. Muslimi for action now. Yana nanom abosomfo, yana nanom mu amuwo wo baby action now. If you say hepatitis no, ebia na wakwa sorry. Ekuro wo hu. Mu ye praises and worship no. Obi hu fifiro hepatitis oba ukuro ni mu a. It's possible. Ibeka say the chances are slim, but it's still possible. Now person busa doctor say doctor, apart from virus emma liver ne ho aka, ibenya hepatitis, ebeka kofa san sempi a wuchire mu. Bibi nso wo ho ebetumi akofa how abre liver no na ya amofre no non-viral hepatitis no.
Niama bi wo ho a ye ya ebetumi ama ye liver no ho ato chima kakra. The edimu the first one.
They say not catch you by force, man. The edimu akotene.
Alcoholism.
And
sanum. Ye the effer no fatty liver. The enono say ono mensa chronic consumption of alcohol can actually cause fatty liver. And so ono mensa body ni breaking it down. Niama bi was insana wanum some chemicals or some compounds in there that can harm the hepatocytes, the cells of the liver, and cause them to be inflamed, and hence causing the hepatitis. Aside that, near mestre say may emfa painkillers no enye chewing gum. Sorry. But painkiller. You know, painkillers have their own side effects. In fact, drugs on its own have their own side effects. So there are some people that have issues with the liver that is drug induced. So the drug breaks down to the drugs to be broken down. There are chemicals in there that can cause harm to the liver. So these two things are the very common ones.
It's painkillers, no. Say yeah, no more. I was here, no senior doctor and a pharmacist. There was 6 hourly, 8 hourly. I thought that morning and evening, depending on the issue. I thought that painkiller need be crying recommending now. If you have liver issues and all of that, but then unfortunately we back drugstore. No, I got painkiller be na or no side effects no onim eno ane so worry sa worry ba ko be 1 hour tipaye yen call you no was sankofa ba ko no worry me on check say 50 o say 70 o say 100 o those classifications no e wo ho seriously o yen hwe painkillers ni ye we say yen jan sabro bebrebe eno so be high. What other things and to me, am I a non-viral hepatitis?
So these are the two major ones, as I said, in our settings that are common. So for all those listening, reduce alcohol consumption, reduce your use of painkillers. Don't just abuse painkillers, or in fact, not only painkillers, drugs in general. And there are some herbal medications to that have some of these implications. So if it is not, there are people that are actually licensed herbal doctors.
Yes.
Yeah. So if it's not a licensed herbal drug, I wouldn't recommend you take it because a bit more high, but my yarena cool. Then so it trust them. And then
side effects no also. Dr. Chiremu say aban ama one ye herbal hospital, herbal clinics ni bi tumi. So one fan adwuma recently obi kra ba ha e de na yi be kire yen Ministry of Health omo won kra bata bi ehwe herbal medicine omo ama ne tumi so one fan enti enko gina ba bia e ka so we draw we beboa woni ba bi ofre no wato no wakonom o se e toda kra tumi eboa ma wo yare ne ko na mmom ensunsuan so e de bebre wo no eno na o ka se yenhwe yie pa se wo de herbal na wo pa ko ba bia aban ama won tumi se won fa nya adwuma doctor yen kan yesi bi yesi se wonum soft drinks bebre pa we obi out there soft drinks ana u di sugar bebre enchini bebre obi kra se sentontom kawa ebetumi ama enti yen kan ehwe soft drinks no yemra esichire ene enchini ene entontom asem no
soft drinks dey me no ka say dey yenye ihwehwemu bi say soft drink be ma liver issue na mum eno so wo niama ebetimi ahaw ebi ne say obi wo ho a sugar problems ebi muso are the over intake of the carbonated stuff give them issues with their tummy and all of those things inti wo niama ebetimi dey aba so me ne ka say dey there is no clear communication that unum soft drinks are obenya hepatitis.
Drinks no bebre I say yare ahodo bi o ha obetumi but after hepatitis dey wunim yenhwe enchine any esichire nso
enchine na esichire so woni omode ba now so omum enye hepatitis na enchine na esichire
okay yenhwe entontom enso de ye say entontom ka obi o hepatitis na so obe kawo a obetumi de hepatitis na ma
but the virus is not known to be carried by a vector like the mosquito.
All right, Dr. Kasa, me did say also we be an person who sana asem bi ame musa e wo ho e kwan say we yes mo de any mo an edi dwuma Max TV ahwe for abon sem amamu mo ye number 1 mo frɛ 0558462088 na ye ni sankomo wo asem bi busa doctor Mr. but en kan che doctor say won kire wadru bi na koto it's not possible you need to be screened you need to test positive they need to know which type it is whether it's B or C and sana mo hu kwan mefa so abo ba wo frɛ na ka say doctor me ni aye yellow mejun so aye tuntum se me nante kakra makoma bom periperi asem afukura ya adoa kakra enti menya de ya ontumi mmoa na mmom wo question bi a nso so yesi no wati bia aha na nso wabusa doctor Esi good morning wo frɛ people kwase hello Esi
yes
good morning doctor ha
okay but you the sorry Siana within the station so and you said something like that was going on but the question I have is my sister was having the same issue, but like starting, when your symptoms or what most of say the left side, maybe a liver and the way or when your belly sensation, like or started to reducing the idea. But I think she was on treatment for some time now, Ojaya, but later on, I had the symptoms need Jaya. The Jaya and fine. She was not having those symptoms again. Later on, that what I'm talking about is about some years issue. Later on, when you science or when more realizes that hepatitis is still in the blood, but as I'm talking, she doesn't show the symptoms again.
Okay,
she's not reducing. She's okay, and the liver pains too. She's not feeling it like at first.
Okay,
and moreover, no, she was doubting Sabia or the amount nukunu, and no manukunu ke test no, nukunu ke no. They said it's negative, so I just want to now, but it's a kind of asthma still get it. Let it see I know what say on Yemen unless I call no one a salmon injection. Does she have to still go for treatment or what? Thank you.
Thank you, Esi. We appreciate your call, doctor. What BBR? Can you take it one by one and explain?
Yeah. So let me just start with the husband. Can the husband get it? If the husband is not vaccinated, and in fact, the husband has not become immune, produced antibodies. Because when the vaccination is when you say, one shot, we jai tomorrow 6, you start again. But if the husband is immune, Mistress say, Wakwama ya wonu sa hepatitis B a pania bebo ne ho ban a ende onya sa yare no. Now second one they say or say nipa ne fa idro e na niama na ba form this animal. Yes.
So jai kakra.
So I mentioned earlier that it's managed. When you have hepatitis B, there are drugs that will suppress the virus, and then it means
the
that
viral load, just like HIV.
Yes, yes. So it means the damage they'll be causing will eventually come down. Yes.
Okay, and in the battle, I would done a year, no, obey me a transmit yes. Just like HIV.
Yes. So there's that risk of transmitting from mother.
So nearby, a DNA, you bet me I am just like HIV, we drew a mother and befa.
Yes.
On so, with hepatitis,
yes.
so we
there's something like that.
Okay.
There's an arrangement like that in clinical settings.
All right. Hello. Good morning. Hello.
Hello.
Me ba talk as a mommy.
Ba talk as a
okay.
Hello. But I'm better beside the so that now with two groups or now with two. Hello.
Me too come on make us.
But I'm beside doctor said so when you brew her and so bad.
Doctor Pacho we busa sem.
We need to brew their number be brain etimi obi was crying moja so nati.
Yeah.
So then the enya say we call hospital na ya hwe say then import in how.
Absolutely. Okay, so you didn't come off for hepatitis B and C who onyankopon ya doma 28th July World Hepatitis Day. Na asemo daso ye gina so ahye fano action now. Ye nyina sorry enye hu bibi. Na say me ni doctor em say ye to ama and sorry. Any Muslim fo nyina any groups ahudo nyina kefit fo nyina e ma nye we hia de so wo be check. Dana, good morning. Dana kasa.
Yeah.
Meton Kadana Kasa.
Yeah, good morning.
Good morning.
You can talk. You can talk that way. Some non stop doing that. If you have something young, you can why
Oh, unfortunately, it wasn't so clear. Mama, Sanfred biom why? Wo bisa asem na wasem a wo bisa na ya ntiase. Ebisa na homa ne twitwe ne mu kakra. Em say asem hia korapo na wo bisa nti wadama. Sanfred biom why? Me doctor wa ha. Doctor, what are some of the wildest things awatiafa hepatitis one wa eye onwa pa. Ba yam pick Dina ne yemra. Dina, good morning. Wo fefi aboso kan ho to say. Dina, good morning.
Good morning.
Anapa ho ye de. Doctor wa hakasa.
Mpachoko. Me ko tested na yesi me wobi. But nipa ko ne say entumi nye affected. Na me person Mr. Doctor say enso me anything.
Mami ka biom nipa ben ne ka sa was in the hospital.
Me ko check here na yesi wobi. But almost say entumi sign entumi plan sign wobi.
Almost entumi nya de Dana, wada makasa why?
No more free screening. Na ipa ne say will ba means me fans. Fan sign.
Okay. Dana, what if I to sonati? Also obi so obi but want me fan sign. Is that possible?
Also a free screening. Free screening usually Hep B screening test is as the name implies, it's a screening test. So you can't depend on Hep B screening test and tell somebody that you can't affect somebody with a hepatitis B virus.
It needs further
exactly. We need to investigate to see. I don't really get a whole idea like behind what she's saying.
But then let's dwell on the inability to transmit it. It's viral. And so if you have it, the viral load would only increase, and that will put you in a position to infect other people.
That's
so
right.
For me, my advice for this beautiful lady who called, go back to the hospital, get a second opinion.
That's exactly so.
That's exactly so.
Exactly so.
But with all viruses, it can only multiply without treatment or management. And a doctor can cycle hospital. Now check. Doctor says 70 Ghana cedis. Abaya sabi ebe check yama why? Naji ukrankwa. Hello, Josephine. Good morning. Josephine, good morning to you. If you can hear me. Okay. Auntie, na nibisa say say ye wanum edro betumi de ama ne ba no wo hepatitis a nti ehun hia say e was all.
Yeah, there's a way that is being cared for. If mama no wo the virus now, so called antenatal care, they have their own arrangements for all of those things. Now say omo wo akola ne so a omo wo pani omo de wo akola.
No. All right, Josephine, what's amba me machu? Josephine.
Good morning. Good morning.
Good morning. Me pacho kasa.
Pacho, let me personally say symptoms living for hepatitis B, Me check it about me say many are no apeja bisa.
Also when you say apeja.
Many are no apeja meaning say symptoms living
Apart from when you say apeja no, symptom obobo so ni bi ani kire say ojunso ebe tuntum kakra, waja nan ebe ye fita wakoma bebo periperi de bia na wabre. Uhunama ye yellow, wahu ebisa.
Me hu bibia sa baje se many are na apeja na me junso ani ye say tuntum bisa.
Ene wada uma ma na mo to mame pe abanya resabia na resabia uko no na kwa se wo hwe max tv no mo ka hepatitis ho asem na opese oba why ya di tinafia ye be wo ya no mebo a enokra de e ba akopɛ ye da se ya doctor ebe na ye bi o but na me busa say in your practice what are some of the things that you've come across where hepatitis is concerned?
So one of the things that I have come across is a very sad story that I encountered where, sorry, there was a man that came to do a test, a routine test. And actually hepatitis B was not even part of the things that he wanted to do. But before he walked out of the facility, he saw the hepatitis B get tested. It's just like a flyer on the wall. So he came back into the hospital and he mentioned that, he has seen the hepatitis B and he wants to test for it. So he tested for it and unfortunately for him, he was positive. So the next thing was to test his family, especially his wife. When the wife came, the wife was positive. They had an early son, one of their boys who was matured. And the dad actually mentioned that the guy was not living two rights, having multiple sex partners and everything. So when he got to know that is also a means, he brought the child and the boy was also positive.
Hey.
So in that family, the mother was positive, the father was positive, and their son, the eldest son was also positive. So the woman mentioned that she knew she was positive, but she didn't tell the husband. So it was a back and forth. Honestly, it was a very big issue. So the end of it all was that there was a likelihood that the lady transmitted it to the husband.
The husband.
And the boy also picked it from his
multiple sex
partners.
Oh, it's possible. What no? Say, we nam why be na we doctor say immune system ne ya. Ebe hye wo kakra but ebe du baby a say one pem wa ebetumi ahaw pa ebetumi the cancer liver failure e do owu kura betumi aba but obetumi a prevent it uko hospital be out say 70 Ghana around that and you betumi a test it after you test now negative ebe one pan there between 10 and 15 years you are safe wo hu tie momodi ane